August is Breastfeeding Awareness Month. It is a time to highlight the importance of breastfeeding for the health of both infants and mothers. Joining us once again is Deanna with Omni Family Health to share expert insight on the benefits of breastfeeding, common challenges, and the support available to new mothers to help them succeed. Hi, Deanna.
Hi, good to see you.
Great to have you back.
Thank you.
Okay, so this one is kind of near and dear to me. You know I have 5 kids, and I did nurse all of them, and it's so funny because there was different challenges with each one, even when I felt like I was an experienced nursing mom.
Sure,
you know?
Absolutely.
So let's talk about why it's recommended as the best source of nutrition for infants.
Sure, breastfeeding has always been thought of to be the best source of nutrition for our babies because it's basically custom-made milk for each baby, right? It has the perfect amount of nutrients and antibodies. It's really easy for the baby's tummy to digest it. It's perfect for our babies.
I love that. Our bodies are so cool that we physically respond to like when our infants are sick, and we make more antibodies.
Absolutely,
for them.
it's exactly right.
So why is it most important in that first 6 months of life? I know that sometimes, you know, when moms have trouble breastfeeding, we try to just hit that 6-month mark is our big recommendation, but why is that?
Right, so a lot of people think that, you know, if I could just make it to 6 months, and it's really true. In the very beginning, especially those first days when you're breastfeeding, you have that thicker milk, the colostrum. It's a little yellowy in color, and some people are like, ew, that's gross, don't use that stuff. That is liquid gold, seriously.
Yeah.
You want to give the baby the colostrum because they're getting not only, you know, the perfect balance of nutrients, but they're getting those special infection fighter cells from the mom straight to baby, which makes their immune system stronger.
And that colostrum is so high in it's protein and fat in the first beginning, right?
Exactly.
And they really need that when they're those brand new babies.
They do, because their brain is developing, you know, all of their organs are still trying to figure out what they're doing in the real world, so it's really important for them.
So let's talk about some of the health benefits for mom with breastfeeding.
Well, I found it was really amazing doing more research on this. I knew it was good for baby, right? We know that. Breast is best, right? We hear that. But for mom, you know, I learned that not only does, of course, it's for bonding. It can help with that bonding time. You're close to your baby. You're making eye contact. You're falling more in love.
The oxytocin.
Yes, all of those good feel good feelings, you know, that you feel when you're bonding with your baby. It helps moms recover faster from their delivery, whether they had a C-section or vaginal birth. It's going to help them recover faster because every time the baby latches on, your uterus is contracting. You know, it really helps you get better faster, and it helps moms reduce the risk of breast cancer later.
I love that. Okay, so let's talk about support and resources for those moms who might be struggling to continue their breastfeeding journey in the beginning.
Sure. I think breastfeeding is so intimate, and people think like I have to do it alone in private. And if you're struggling, that means you're suffering alone in private, and you really don't have to do that. There are so many resources in the community. Ones that I've used in the past, and I know that I recommend for my patients, Baby Cafe Bakersfield is a great one. Baby Cafe is so cool. It's certified lactation consultants. You can drop in anytime in person or virtually, and they will help you with breastfeeding needs. The hospitals have lactation consultants that will help you. At Omni Family Health, we have health center nurses, our pediatricians, and our family practice providers are really experienced in new moms and new babies and helping those moms figure out the challenges that come with those new breastfeeding challenges.
Sometimes you need an extra set of eyes to figure out what the issue is because it could be something you never thought about, and it can be fixed so quickly.
It might just be a hold different, you know, instead of doing this, we're going to do a football hold this way, and you never would have thought about that because it doesn't feel natural at first.
Right. So what are some of the common complications that breastfeeding moms should be looking out for to keep their health up?
Sure. So one thing is latching issues, right? We see issues with latch where mom will say it just hurts really bad when they latch on. And so we don't want that to be the case. You know, it should be comfortable. And so latching, making sure that the baby's head is in the right alignment, that, you know, the nose is lining up with the nipple, all of these things that we can teach mom so that they're more comfortable, that the baby is getting that milk out a little bit better. And then we see clogged ducts a lot. I'm sure as a mom who's breastfed babies, you've experienced that. I have too. It's so painful, right? So we don't want moms to just hide that or think it's just breastfeeding. No, a clogged duct is serious. It can turn into a serious infection called mastitis. So if they think that they might have a clogged duct or they think they might be developing infection, we want them to come in, see one of our healthcare providers because they could need antibiotics. They could need other help and techniques to get better so it doesn't turn into a huge infection.
Yeah, there's so many techniques that can head it off before it turns into that infection. And once you know them and you kind of know the feeling, then you know to implement them.
Like it's coming on. Yeah,
I know it's coming.
I always tell my new moms, you know, I know that you tend to want to grab the pump and pump that clogged duct away, but your baby is a far more efficient pump than the pump is. So grab the baby.
So let's talk about some of the common myths about breastfeeding versus what science says.
I love the myths. Okay, so one myth is is that it should just come very naturally. And while it is natural and our bodies were made to do it, it's hard.
Yeah,
right?
it
And
is.
it takes some practice.
For mom and baby.
Yes, yes. So when moms say, the baby just doesn't want to latch on, girl, he's still learning how to do it.
He doesn't know how to do it either.
Right? So I think just letting them know, like, we listen and we do not judge, right? We get it. It's hard, and your baby doesn't know what to do. You might not know what to do yet. You both are figuring it out. So just reminding people that it does take practice.
Right.
You know, so it's okay if you feel like you might be failing today, because next week you might be a pro.
Right.
So give it a chance.
Yeah.
My other favorite myth is you can't get pregnant while you're breastfeeding.
You absolutely can.
Sure you can. Yeah, I can't tell you how many women we've seen for that 6-week follow-up for their postpartum, and they have a positive pregnancy test. So yes, you know, breastfeeding can delay your period and menstruation. You might not be having one, so you're like, I'm good. But no, you can absolutely get pregnant, so definitely come in and talk to us about your birth control options. And then the last one we talked about a little bit before is that if I'm sick, I should stop breastfeeding. And that's not the case. Yeah, because you might have a flu or you're cold or something, but your body is creating these infection fighter cells. And by breastfeeding, you're passing those on to your baby, making the baby's stronger immune system.
Amazing. Breastfeeding is amazing.
It is really cool. It is really cool.
So for our friends at home who might need a little assistance with their nursing journey, how do they get a hold of you at Omni?
Yeah, so we want them to call us, come into the clinic. We even have walk-in clinics. Just come in. We would be happy to help you with breastfeeding. It's one of our favorite things. You know, we'd love to see the new babies and see the new moms and make sure they're feeling okay. You know, someone might be having, you know, post-baby blues, and we don't know unless you come in and talk to us. So just come in, make an appointment. We can help you get hooked up with one of our health center nurses, do some weight checks for the baby, and make sure that we can just educate moms on the things that they're looking out for.
Amazing. Well, thank you so much, Deanna. It was great to have you back.
Thank you so much.
All right, Deanna and I are going to keep chatting. We got more Studio 17 coming up.